Kia ora. Welcome to the Ubuntu 2024 podcast. I'm your host, Dr. Joe Scott-Jones. I'm a rural GP based in New Zealand. The word Ubuntu comes from the Zulu and Xhosa languages and can roughly be translated as humanity towards others, the belief in a universal bond of sharing that connects all humanity. I am because you are. Ubuntu 2024 is an in-person and online conference jointly held by the Network Towards Unity for Health, TUFH, and Rural WONCA, the World Organization of Family Doctors Working Party on Rural Practice. Ubuntu 2024 will be the 45th anniversary of the Network Towards Unity for Health and bring the TUFH annual conference together with the 20th WONCA World Rural Health Conference. Hosted by 5 partners, the University of Western Cape, University of Cape Town, Stellenbosch University, Cape Peninsula University of Technology, and the Western Cape Government Department of Health and Wellness. In September, Cape Town, South Africa, will see Ubuntu 2024 bring together health professionals, educators, thought leaders from across the globe to explore the theme of people, place, and policy for community wellness. And today, I'm talking to Klaus B von Pressentin, an associate professor from the University of Cape Town. And I know that, so Klaus and I met at the WONCA conference in Sydney and enjoyed some wonderful sort of social times, as well as a really interesting and informative conference. But Klaus is one of those doctors who has a doctorate, a rare amongst us, I think, or certainly in my circles, a doctor. And his research interests lie in primary healthcare, health systems and human resources, strengthening of health systems, and also health professional education. So Klaus, did I get any of that right, or am I completely up the wrong tree?
Thanks, Joe. No, you've got it right. I mean, it's yeah. I think listening to that list is always like baffling that one had come to this point of having had these opportunities over the career so far to have been able to delve into many of those fields. And I think primarily maybe because I'm a see myself firstly as a clinician, but also as a clinician scholar with the education and research aspects, and as a journalist. So that's probably why there's such a wide range of topics in it. I find that especially looking at the interface between the individual and the collective, so the patient in front of you, the family that they represent, the community that they represent, and seeing about those linkages, especially around the team that provides care for them, and also the service and the system, bigger system that is meant to support this interaction at the primary care coalface. So those, I think that's probably why the range of interest areas is so broad. Bit daunting at times, but it's also very invigorating to be able to switch between these different focus areas. Yeah.
I love that. It resonates a lot, I think, with many of the people that are getting involved in these sorts of conferences as well. That we are interested in the system that supports the community, the families that we care for, and wanting to understand it better so that we can change it and improve it. But tell us a little bit more about yourself. What are your outside interests, if you have any time?
Yes, I do. So the outside interests are generally also outside in outdoors. So
All right.
really enjoy. So my weekly sanity is a Sunday morning cycle, normally with colleagues or friends. Just getting out into nature. Also with my family, we like doing hikes. We're actually going on a hike in a couple of weeks with some friends. So that's also a way of just connecting with nature and just getting away from the work and the busyness and the digital side. But not that I don't love the digital side. In fact, I'm also, one of my other interest areas is to see how technology can actually enhance and support us in our daily functions. But I do feel that we all need to disconnect at times, with just to find a bit of peace and energizing ourselves in green spaces.
I know my wife is planning to come with me to the Ubuntu conference, and we're hoping to do a little bit more of that sort of exploration around Cape Town when we're there. So I assume that there's lots of opportunities for that sort of thing, activity.
Absolutely.
Yeah.
Yeah, absolutely. I mean, it's springtime in Cape Town. So last year the springtime was a bit coolish, but it's actually perfect weather to then hike up to Table Mountain and do some sightseeing on foot or on a bike around the either Cape Town or the broader Cape Winelands area. So there's lots of areas things to do. Especially with it not being that hot yet. So it's actually quite nice to get outside.
Oh, fantastic.
That time of year.
I am so looking forward to it. But tell me a little bit more about yourself. What was it that drove you into medicine? Is it something that you always wanted to do, or is it was there something that inspired you to choose medicine?
That's a good question. I must say, I think I've always enjoyed working with people. And I went straight into med school after high school. And I think when initially, I mean, when you get in your preclinical years, there's a lot of studying, a lot of textbooks. But when I started engaging in the clinical years with patients, and really getting to know the stories behind the individual in front of me, that sort of made me realize that I'm on the right track. And I think then also I was quite fortunate to, in my internship and community service year, to connect with people in more rural communities, rural clinicians, wonderful doctors, nurses, allied health workers. I've worked also with some Cuban trained doctors, which also inspired me about the need to look beyond the health services into the primary care spaces, and seeing how community wellness, individual wellness is really much more than the health service itself. And I think, and I enjoyed a range of disciplines. So at the end of I mean, in South Africa, we do 2 years of, I still did the 1 year of internship and then 1 year of community service. And at the end of that, that second year, that community service year, the arrangement at the time that was that as a community service doctor, your role was you're based at a regional hospital serving a large rural area, but
Right.
also part of that experience was to relieve other community service doctors in their leave period at the small district hospitals, the level 1 hospitals in a bigger area. And that was such a formative experience. So I realized that I didn't feel like there was a particular field in medicine that was calling me. I really wanted to have it all. And then my medical manager told me I must speak to Hofi Conradi, who I hope will be at the conference next year. He was at the time the family physician at the Worcester Regional Hospital. And that's how it all started. That's how my journey in family medicine started.
It sounds like you bring together you bring together the rural experience as well as the towards Unity for Health and that focus on social accountability and responsibility. You really embody that. So that's and being a rural GP, there's something special about rural communities. I think it's because it's easier in a way to get embedded and to connect it into the community. It just is really professionally very satisfying. And certainly for me, you get to use a whole wide range of skills in those rural communities as well. You know, you can't default to the nearest specialist all of the time. But yeah, so in terms of the University of Cape Town, does it do? I mean, apart from growing people like you and supporting you in what you do, does it do? What role does it play in bringing people together and advancing health and well-being of the most needy in society?
Yeah, So I joined University of Cape Town in early 2020 at the same time when the new faculty leadership of the deanery team started with Professor Lionel Green Thompson, our dean, who is also on the board of the Towards Unified Health organization. And from the outset, I mean, I think our values resonated because him and then also his fellow colleagues in the deanery, the deputy deans, have really embodied and put forward this social mandate of being accountable to certain target communities that we serve, both in the Cape Town area, but also in the adjacent rural districts where our students learn and serve, such as the Garden Route and up in the West Coast in Saldanha Bay. So, and I think that over the last 3 to 4 years, I've noticed how that has also inspired others to be really connected and be aware of the being socially accountable in terms of engaged scholarship and how we teach and how we do research with communities, not on communities. So there's been a big shift also around realizing that we need to transform our undergrad curriculum across the different health professions. And over the last 2 years, our Deputy Dean for Undergrad Education, Karen Beck, has led a curriculum transformation process through actually a leadership program for emerging scholars and teachers in health sciences education. And that has led to a number of wonderful projects that are all connected into a bigger umbrella of being socially accountable and transforming curriculum to shift that we need to train specialists as well, but I think we also need to know that the bulk of our communities will be served by generalists and at a graduate level. So when you graduate with your first professional degree, you should be a generalist that's fit for purpose for our communities. So we have quite a over the last few years, quite a strong emphasis on integrated teaching, trying to work stronger towards interprofessional education, and also bringing languages on board so that our graduates are also able to converse even at the basic level with patients in their home language. So those are the type of things that I think there has been really struck me also about how we can do things in a much more engaging way in partnership with communities. There's also a wonderful new project that's coming online over the last year, where we also want to focus on stronger community engagement, specifically for young people under the age of 35 and women, especially in terms of health entrepreneurship, strengthening primary health care. And that's also led by our Deputy Dean for Social Accountability in Health Systems, Tracy Naledi, who will also be quite integral to the conference. And then, of course, our head of department, Steve Reed, who will also be quite involved, especially as he's heading up our new combined Department of Family, Community and Emergency Care, which has also been a product of the leadership of our new deanery team over the last 3 years. Yeah, so I think we're in a good space. There's a lot of energy, and we hope that the momentum we will be able to see that through, and that colleagues who are joining us next year in September, I think there's a lot of opportunity for shared learning there. I think we obviously haven't got it all figured out. I think there's a lot of contextual realities, especially with an environment where there's issues around financing and funding, how to come up with solutions that are community engaged in spirit and values, but how can we transcend the realities that we experience when we want to expand our community learning platform, etc. Yeah, so I'm really looking to learn from colleagues from all over the world at the conference next year.
Which is fantastic. That's exactly what we wanted to hear is, why should we come to Ubuntu 2024? But I gather there's also another conference that's sort of quite closely linked to it.
Yes, so yeah, thanks for the opportunity to have a little plug-in about our national conference. The South African Academy of Family Physicians has an annual congress for primary care practitioners, GPs, family physicians, primary care teams, and that's normally happening in August. So UCT, so I'm the main chair of the organizing committee, in partnership with our colleagues in the University of Limpopo, right in the north of the country. We are co-hosting our National Congress, and we've actually moved it up so it coincides with the combined Ubuntu conference. And oh, I have a dog in the office with me. I don't know if there's a sound came through.
No, we didn't hear it
Okay.
at all.
Oh, okay.
Welcome
Well,
to join us on the podcast.
sorry, it's a beagle, and she's clearly seeing something outside. I don't know, you probably were able to move this part of it. Anyhow, so
No. We'll keep this all in. This is all human interest.
Human interest, yes. So absolutely. So a part of our extended family, we have 2 dogs in the house. So there we go.
Well done.
So circling back to our conference, our national congress for family physicians and GPs. So it's going to happen the weekend before the Ubuntu conference, and our hope is that this will be an opportunity to attract colleagues from our Southern African region who are interested in primary healthcare and family medicine and family practice, to also then stay on for the Ubuntu conference, which has the Towards India for Health as well as the Rural WONCA colleagues. Our main theme for our Congress is family medicine strengthens primary healthcare, creating opportunities from adversity. And we were talking about the conference will be looking at things around strengthening comprehensive primary healthcare, looking at sustainable quality improvement and health service strengthening, as well as focusing on the people that provide primary healthcare in terms of capacity building, interdisciplinarity, and teamwork. And then obviously looking also at how digital solutions and the fourth industrial revolution can augment the provision of high quality primary healthcare. So I think there's quite a conceptual alignment between these two conferences, and my hope is that when people come to the academy conference, which will be in the waterfront, so I think that's going to be where most people most delegates of the Ubuntu Congress will stay. Will make, if they want to, just make sure that their travel plans are shifted a bit, so they come already on the maybe the preceding Friday or Saturday, that they join the National Congress and then stay on for the especially the Rural WONCA side that's starting on the Tuesday, and then the main Ubuntu conference that starts on the Wednesday. So there's this alignment between activities, and I would be quite interested to see how that pans out. To what degree can we already build up excitement and energy during this sort of informal pre-conference into and leading up to the Ubuntu conference. So yeah, so that's a little opportunity to stay a bit longer. And then there's obviously like a day or two break between the two conferences to avoid conference fatigue. So you can do the trips in the Cape Town area that you were talking about earlier.
Fantastic. I mean, the way you were talking so passionately before, I was thinking, gosh, I really want to become an undergraduate and study in the University of Cape Town again, because it just sounds fantastic. It sounds absolutely awesome. That expansion of the connection with community. That is, one of the things that really brings most of clinicians joy in work is our connection with people and our connection with community. And you're embedding that and strengthening primary care through the whole of the curriculum. And yeah, it just sounded so exciting. So
Yeah.
thank you for sharing some of that spirit and that enthusiasm. We're looking to tap into more of it for both the Ubuntu conference and the Congress for, what's it called?
So it's the national. Sorry, it's let me just get the proper name up. So it's by the South African Academy of Family Physicians, which are the hosts, but it's the annual National Congress for family practitioners. So it's really open to family physicians, primary care teams, general practitioners. Yeah, and we really want to broaden the focus of the National Congress to similar profile of delegates that are coming to the Ubuntu conference, to make sure that it's open to everyone who identifies with the practice, the training, educational aspects, and the research in primary healthcare, especially in community spaces. Yeah.
Sounds fantastic. So to find out more about the annual National Congress for family physicians in South Africa, and the Ubuntu 2024 conference, go online and or visit the website ubuntu2024.com. And thank you so much again, Klaus. This has been absolutely wonderful. Lovely to sort of talk to you again, and hopefully that's inspired a few more people to buy their tickets and to come along to the conference. And yeah, I'm looking forward to it. We'll see you there.
Wonderful. We look forward to having you here.
Okay.
Thanks, Joe.
Kakite.